do I get to pick the color?
You do.
Oh,
You
that's really
do.
all I care about.
You do.
I'm shallow
Yeah.
enough. I just want to know that if I want red, I can get red. If I want blue, I can get blue.
Yep.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Another new month and another new episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Jordan Strong.
In today's episode, we find inspiration from the world of customization. Authored by Dr. Carly Michelson of Elite Hearing of Colorado Springs, we'll discuss the new hearing aid technology and how it can be tailored precisely for you. So, Dr. Jordan, before we get into that, have you ever hyper customized something specifically for you, like a shoe or a shirt? I feel like that is ubiquitous in today's consumer culture, where huge, small, medium-sized companies are like, hey, instead of us just doing it for you, why don't you design it for yourself? And we'll just provide the platform for it.
That's a good question. I think maybe a shoe.
Nice.
I think I've done a customized shoe before. I think it was a Converse or something.
That's amazing. I've wanted to customize something before. I just never have, because I either think it's too boring and I'm like, what? Why? That was so dumb. Or I go so over the top.
Yeah.
I think that's so garish.
Yeah.
You're going to hate it the second it's delivered.
Yeah. I think I did it when it was first coming out.
Yeah.
I was probably middle school or so.
That's amazing.
Yeah.
When you say middle school, it makes me feel very old, because in my head I was like, customization's only been around for 6 years. Dun, dun, dun.
No, I was not in middle school 6 years ago.
Good. Yeah, neither me. I mean, I was, but it's not a big deal. It's fine, whatever.
Yeah.
So talk to us about, and this is what I think is really cool. Audiology is ever changing, and technology is always at the forefront of it. So talk to us about some hearing aid technologies that are allowed to be customized for the end patient.
Yeah, so different styles of hearing aids can be custom. I mean, obviously the programming will always be customized for you, but the physical fit of that device can be customized to you. It's customized, past the point of prescription hearing aids. Physically, the hearing aid can be customized to you. So something like an ear mold that can be put on a behind the ear hearing aid, or even something that's very, very small that goes down into the ear canal. More than likely, it needs to be customized. Sure. It needs to be molded for your ear. Okay. So kind of like how I guess more people might be familiar with getting a dental impression.
Oh, for sure, yeah.
This is kind of similar to that, to where traditionally we would put putty in the ears.
Okay.
Putty.
Like silly putty? The stuff you can take comic strips off of?
Not exactly. Okay. But it is an impression material that we use to get a mold of your ear.
Got it.
We also have other things now, like scanners, where we can scan your ear.
Oh, like 3D stuff?
It does.
Cool.
It is a 3D image that we can just directly send to the manufacturer.
Awesome.
And those are really cool too.
For sure.
But yeah, we can get that hearing aid to be completely customized, fit your ear. It's not going to fit anybody else's ear, and it doesn't even fit the opposite ear on the same person.
That would make sense, because I just imagine, even though it's on the same person, they are still
very
different orifices, right?
Absolutely.
So the pro to that is obviously it's a one of one. It is for you.
Absolutely.
And if somebody comes to you and says hey, I want this customized ear mold, what are the steps along the way of making sure that they even need one, let alone actually can get one? Right,
for sure. So, we're going to look at their hearing loss, the type of hearing loss, the reason for the hearing loss. We're also going to look at the health of their ear canal. Can their ear canal, are they a wax producer?
Got it.
Do they have frequent ear infections? All of those things are going to kind of drive what type of hearing aid that we're going to go with, and if we're going to go with something that's down in the ear canal like that or not.
Got it. So there's I mean, short of something outlying, if somebody says hey, I just based on your recommendation, your diagnosis, I think it's just going to be the best case scenario for me to have that customized mold. That's right. It's going to depend. And like I said, it kind of depends on the hearing loss too, because what can happen is if you have good low frequency or low pitch hearing, if those are normal, mild type of hearing loss there,
we may not want to go with something that is occluding like that.
Got it.
Because what's going to happen is that can make it sound like you kind of have your fingers in your ears.
Oh, yeah.
You're going to feel more plugged up.
I have wondered about that. So, you know, like, because this is something that's obviously been around in music for a while, right? Those custom ear molds.
Yeah.
So the
In-ear
musicians,
monitors.
ear monitors, right, so they can hear. I always wonder, and I thought about this the other day, how tight do you actually want that in there? Because I feel you would still want air to be able to flow through there.
Right.
But at the same time, you want it to adhere as tight as possible. So, like, what's the threshold for that?
So it actually, it's going to depend on the hearing loss that you have.
Okay.
The less severe the hearing loss, the more open of a vent that we need to have on that hearing aid.
Got it.
The more severe that hearing loss, you're going to have a very small vent, if a vent at all.
Okay.
Because we need to keep all that sound in the ear canal and not leaking back out.
Got it. So then, like, obviously, if there's a pros to something, there has to be a cons to something. So, like, I guess a lot of wax would be something, would be an issue. What else would fall under, hey, this just isn't going to be the right thing for you? Right.
Definitely if you have good low frequency hearing or low pitch hearing, we're not going to typically recommend that. And other reasons may be, like, if you're interested in something like Bluetooth connectivity, like for your phone, more than likely those very small devices aren't going to fit it.
Got it.
Or if you want a rechargeable device, those typically take disposable batteries and you're not going to be able to do rechargeability.
Oh, got it. Okay.
So sometimes it comes down to, what do you want out of a hearing aid? You know, what do you want that hearing aid to be able to do? And that will also kind of drive our conversation of selecting the most appropriate hearing aid for you.
Got it. And so, like, that kind of falls into, like, performance, right? And so there's obviously a ton of intricate mechanics that go into a hearing aid. Is that different in a customized hearing aid than something that, you know, just kind of, I don't know how you refer to it, fits off the rack?
Yes and no. Definitely the larger that ear canal is, the more that the manufacturer can fit into that hearing aid.
Got it.
The smaller your ear, we're not going to be able to fit all of those components in it. And it can really vary based on not only the style of that hearing aid, but also just the size of your ear canal.
For sure. So for something like that, are there anything like accessories that come with it? Is there... Are there add-ons? I'm trying to just think of, like, in my head of, like, well, if I was going to make a shoe with Nike's going to give me all these different things that I can do. What are some cool add-ons to that? Yeah,
so it's going to vary by manufacturer, but typically there's going to be some type of accessory that will work with that device. Okay. If it doesn't have Bluetooth on its own, which a lot of them do now. I would say most of them do. But if it doesn't, then there's definitely some accessories that you can get to possibly make it be a Bluetooth device. But there are some where that technology just can't fit.
Sure.
And it's got to go to the wayside. We want you to hear before you can play with your Bluetooth.
For sure. So I know some people are listening to this and they'll be like, well, hey, I know that if I'm going to customize something as opposed to buying something that's been mass produced, it costs me a little more. Without getting into the exact price parameters of this, what typically is the differing cost of a customized hearing aid? Yeah,
so that's more than likely it's going to vary by practice and by office that you go to. So I know for our office, there is no price difference as far as the look of it goes. Okay. Technology, the level of technology is typically what's going to drive the price of that device, and not so much if it's custom or not.
Do I get to pick the color?
You do.
Oh, that's really all I care about. I'm shallow enough. I just want to know that if I want red, I can get red. If I want blue, I can get blue. Yeah.
It's going to definitely vary by manufacturer of what colors they have. But yeah, they've got all the fun colors.
Oh, I love it. And now that you know more about this technology, you can make an educated decision with your doctor if it's right for you. And should you need any more information about audiology, please go to askanaudiologist.com for more tips and insights. Dr. Jordan, thank you so much.
Absolutely.
See you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.